Hello, my name is Paulina. I'm going to be your nurse today. Can you tell me your name and date of birth?
John Smith, 1/2/1911.
Nice to meet you, John. I'm going to be doing an assessment on you, if that's all right.
Yes.
Okay. So we'll move your wristband over here for a second. Can you tell me where you are right now?
In Rensselaer, New York,
Okay, and why are you here today?
for a physical assessment.
Perfect. And do you know what year it is right now?
2025.
Perfect. Okay. So I'm going to ask you a few more questions. The first one is going to be based on judgment. If you were to find a wallet on the side of the road, what would you do?
I would bring it to a police station.
Okay. Now we're going to have some critical thinking. What is the similarity between an apple and an orange?
They're fruit.
And what is the difference?
The color in an orange is a citrus fruit.
Okay. And for your memory, what did you have for breakfast this morning?
A bagel.
Okay. Perfect. So I'm going to start my head to toe examination on you. I am first going to be touching your scalp. I noticed that the patient has some hair loss. He has some scars from previous, I would say, acne. Maybe, did you ever have chicken pox previously?
Yes.
Scars? Okay. It's smooth, soft. I don't feel any deformities in the skull. The patient himself does not look as though he's in distress at this time. Breathing is within normal limits, no rapid shallow breathing. Are you in any pain right now?
No.
Okay. I'm looking at his facial symmetry at this time. He's got equal eyebrows. Can you smile for me? He's got symmetrical smiles. Overall, his face is symmetrical. I'm gonna just touch your face to see if you can feel me. Do you feel me touching you?
Yep.
Okay. I'm gonna also just have you close your eyes, and I'm gonna touch your face to see if you can feel where I'm touching you, okay?
Forehead. Right cheek. Nose.
Perfect. Okay. Now I'm gonna just take a look in your eyes and see if you can, I'm going to look at your pupils, see if they react to the light, and then I'm going to do some other movements that I'll tell you what to do next, okay?
Mm-hmm.
Right now, you're just going to look at my nose. I'm going to shine a light into your eyes. You're not going to look at the light, okay? All right. So your pupils were 3 millimeters to start. When I flashed the light into your eye, they went down to 1 millimeter. Reactive, brisk. I'm going to have you follow my pen light with just your eyes, not your head, okay? Perfect. All right, now I'm going to also have you tell me when you see the pen pop up in your peripheral, but you're not going to turn your head, okay?
No.
Okay.
No.
Okay.
No.
Okay. And then,
No.
perfect. Okay. So I'm going to shine a light in your eye one more time, but just continue to look at my nose, okay? All right. So this gentleman's pupils also react on the opposite side when the light is flashed in the opposite eye. I'm going to take a look to see if he has any internal issues with his eyes. I'm going to just quickly flash the light into your eye again. I see a pink reflective light. His sclera is white. He's got blue iris. Pupils are round, reactive. Okay. He doesn't have any discharge. I'm going to take a quick look at your conjunctiva on your eye, okay? Pink conjunctiva, perfect. His lacrimal duct is not secreting anything at this time. Do you feel any pressure?
No.
Okay, since I'm already palpating your face, I'm going to just touch your sinuses as well. Your frontal sinus, any pressure or pain?
No.
And your maxillary sinus?
No.
Okay. I'm going to take a peek at your nose as well. I don't see any deviation Do you mind if I just look in your nose? He does have hair in his nose, pink, red, no deviation like I suspected. Then I have you occlude one side of your nostril. Take a deep breath with the other, and then do the same. Perfect. Now close your eyes. I'm gonna have you smell something and tell me if you can recognize it. Go for it.
Smells like an apple candle.
Yep, apple candle. Perfect. Okay. Doesn't have a runny nose, no discharge. I'm gonna be looking at his ears next. So as I'm looking right now, I can see his auricle does not have any draining, redness, swelling around it. I'm gonna touch your tragus. Any pain while I'm touching?
No.
Okay, perfect. Okay, no redness, no swelling. I'm gonna pull up the pinna, take a peek inside to the tympanic membrane. Okay, it is flat, gray, translucent, and the light reflects at 5 p.m. And I will do the same on the other side. Findings are the same on both sides. Okay, now I'm gonna have you cover your one ear closest to me, and I'm gonna whisper 3 things to you, and you tell me what you hear. Banana, apple, orange.
Banana, apple, orange.
Perfect, okay. And I'll have you do the same on the other side. Pumpkin cheese pie.
Pumpkin cheese pie.
Okay. His hearing is within normal limits. From there, I'm going to inspect his mouth. You see he has facial hair. Can you just smile for me? Okay, open your mouth. Okay, this gentleman is missing a couple teeth in the front. I'm going to take a peek. Do you mind sticking your tongue out for me? Say ah. Again. Can you say I again? Okay. All right, his uvula vibrates. I'm gonna take a look at his buccal mucosa. It is pink, wet, moist. Can you move your tongue side to side? Up and down? Perfect. Now I'm gonna have you stick your tongue back in your mouth, push against my hand, and again on this side. Okay. Nice and strong mouth movements. Do you have any trouble swallowing?
No.
Okay. Any issues with your taste?
No.
Okay. All right. So from there, I am going to be inspecting your neck. It looks like this gentleman does not have any tracheal deviation. I'm going to be palpating for lymph nodes. Okay. So we have the pre-auricle, post-auricle, tonsillar, submandibular, submantle, superficial cervical, deep cervical, occipital back here, and then underneath that is the posterior cervical. And then I'm going to have you shrug your shoulders. Okay, supraclavicular as well. Perfect. You can put your shoulders down. Didn't feel any lumps or bumps. Was any of that tender for you?
No.
Okay, so all of that is within normal limits. Going to be feeling for thyroid. Will you swallow for me? Okay. No swelling in his thyroid. Any pain?
No.
Okay. So from there, I'm going to have you shrug your shoulders again. I'm going to test your range of motion. So just up and down a couple times. Perfect. Can you move your neck side to side? We're doing range of motion up and down as well. Perfect. Neck has full range of motion. Any pain with that?
No.
Okay. I'm going to be testing your jaw as well. Will you just open and close your mouth? Okay, thank you. I don't hear any clicking. I don't feel any pressure within normal limits. We'll do your arms next. I'm going to have you put your arms up and then put them back down behind your back. Okay, can you swing each arm separately in a circular motion? Okay, full range of motion. Okay, Can you push up against my arms? Perfect. Push down against them. Perfect. Now I'm gonna have you bend your elbows in and out. Perfect. Now I'm gonna have you push against my hands. Perfect. Again. All right. Your wrists as well. Wrists around and around. Perfect. I'm gonna have you push against my hands. Okay. Again. And now we'll do your hand strength. Squeeze my hands. Perfect. Now I'm gonna have you pull me towards you. Push me away. Perfect. Can you wiggle your fingers? Okay. While I'm here, I'm gonna note that he has dry skin, appropriate to race color. There's no openings, lesions. Hair is appropriate for him. I'm gonna check his vascular. Got cap refill of less than 2 seconds per finger. Pink, blanches. We'll also do skin turgor real quick, where you pinch up the skin. Immediate recoil. You're well hydrated. From there, I am going to check your carotid pulse as well. Only one side at a time. Perfect. While I'm checking pulses, I'm gonna just move down the body. So I'm gonna do his brachial. Move down to his radial. His pulses so far are +2 on each of the ones I've tested so far. I'm gonna go to his palpatile, back up to his femoral. Sorry, I forgot those. Down to his post-tibial behind the ankle. And then, could you bend your knee up? Sorry, so we can get it in. And his pedal pulses. Perfect. All are +2 strong. Okay. So from there, I am going to listen to his heart sounds. Okay, so we're gonna be listening for S1, S2 gallop with no S3, S4, hopefully no murmur. We have his aortic, pulmonic, herbs, tricuspid, and mitral. Okay, there was S1, S2, no S3, S4 present. Normal heart rhythm. We're going to be listening to the apex of the heart for his heart rate. We listened for a full minute, 80 beats per minute, normal. Did not hear any skipping of beats. I'm gonna also be pressing. Do you feel any pain around your chest?
No.
Okay, it appears that he is symmetrical. I'm gonna also now be listening to his lungs, but first I'm gonna check for edema. Have you noticed any swelling recently?
Nope.
Okay, I'm checking all the way down to his feet. There's no swelling, no pitting edema. So that's a good sign. His cap refill was normal on his fingers. I'll check cap refill on his toes while I'm down here. All his toes are less than 2 seconds. I'm gonna listen to his anterior lung sounds. I'm gonna have you take a deep breath every time I move my stethoscope, okay?
Yep.
Deep breath in and out. Okay, nice clear breath sounds anteriorly. I don't hear any rhonchi, rails, or crackles. Any shortness of breath?
Nope.
Do you smoke?
Nope.
Okay. So I'm also going to take a look at his skin underneath. We're going to pretend that he's bare. He does have a tattoo in the front here. He has, what? I'll just pull it up. He's got hair appropriate for his race and his skin. I don't see any scars on his chest. We'll do the abdomen in just a second. I'm gonna go to his posterior lungs. I'm gonna have you take a deep breath in and out with each movement of my stethoscope. Go ahead. Okay. Okay. Okay, now I'm gonna hold underneath his ribs, pinching a couple centimeters of skin together between my thumbs so that I can see if his lungs expand when he takes a deep breath in. Go ahead. Perfect, so we have some expansion. He is symmetrical in the back as well. Now I'm just gonna palpate back here, and you tell me if you have any pain. I'm palpating down your spine. Any pain?
Nope.
Okay, how about over here?
Nope.
On your side? Other side?
Nope.
No pain anywhere?
Nope.
Okay, perfect. Would you mind standing up for me? I'm just gonna take a look at his spine while I'm back here. It looks symmetrical, no deviation of the spine. Would you mind bending? Okay, good arch, there's no deviation. Spine is correctly curvature. Okay, you can stand up now. Have a seat again. So unfortunately we don't have a place for you to lay down for your abdominal assessment, but instead I'm gonna just have you kind of slouch in the chair if you can. Thank you. Okay, so we're gonna look first. Abdomen doesn't appear to have any bulges. It's a little round. Hair is appropriate. Do you have any pain before I touch?
No.
Okay, so now I'm gonna use my stethoscope to listen. I'm gonna listen to the 4 quadrants. Okay, we got gurgles. Okay, I noticed that you have a scar above your belly button. Is that from a surgery?
Yes.
Okay, what did you have done?
My appendix removed.
Okay, all right, so now I'm gonna touch. You let me know if you have any pain. I don't feel any bulges.
No pain.
No pain, perfect. Okay, he is tympanic all over. All right, you can sit back in your chair, thank you. When was your last bowel movement?
10 minutes ago?
Okay. GI issues?
Yes.
Okay. All right then. So now I'm going to inspect your hips. Any pain in your hips?
Nope.
Alrighty. Can you, I'll have you stand up and just kick each leg out. Okay. Alright, any pain while you're doing that?
Nope.
Okay, have a seat. I'll have you bend your knees out and open. Perfect, back down. I'm gonna have you push up against my hands. Okay, push down. Okay, same thing with your lower legs. Okay, again. And then for your ankles, can you roll your ankles around? Okay, perfect. All right, so then can you pull your feet up? Push them down against me like a gas pedal, perfect. I'm gonna be looking at the bottom of your heels. I don't see any wounds, perfect. All right, skin looks appropriate, no breakdown. I did check your cap refill earlier, okay. I am gonna have you stand up. I'm gonna have you slouch to the side and then to the other side. Okay. Now I'm gonna have you close your eyes and stand for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, he did not sway. His balance is intact. I'm gonna have you take one of your feet and drag it down the shin of your other foot. Perfect. Do the same for the other. Okay, a little loss of balance, but okay. Do you feel dizzy at all?
No.
Okay, perfect. Now I'm gonna have you sit down. I'm gonna have you touch your nose and then touch my finger. Okay. Perfect. Alrighty. I think that concludes our assessment. Thank you for participating.